continues to be a big pressure point here in the QCA. TV6 Investigates Matt Christensen looks into the local impacts and how one expert in our area says the proposed savings could end up costing you in the long run.
Healthcare providers and people covered under Medicaid in the Quad Cities say they're both at risk by provisions in the bill. Republicans aim to cut back on Medicaid and food assistance for the poor to cover $4.5 trillion in tax cuts, and that'll have deep impacts to healthcare in Iowa and Illinois. Some 94,000 Iowans stand to lose healthcare coverage, about 3.3% of the state's total population. About 450,000 will lose coverage in Illinois, about 4%. But it's not just people losing coverage. Hospitals say they'll be harmed by picking up the costs.
We are not allowed to turn patients away due to a lack of ability to pay, like any hospital, very similarly, or emergency department. And so the patient is still going to come. We're going to have to figure out how we're going to provide that service to them when they need it.
Some healthcare providers will likely pass those costs on to other patients to cover the losses. Lawmakers representing the Quad Cities have voted along party lines. The bill has to pass the House again before Trump can sign it into law. Meanwhile, healthcare providers are bracing for the fallout.
A lot of it is about fear of what is going to be lost, what are they still eligible for, how are we going to communicate that out. A lot of that depends on when the final text of the current bill that's being debated comes through.
In Davenport, Matt Christensen, TV6 Investigates.
Other changes to Medicaid include imposing work requirements on people, including some parents and older Americans, making sign-up eligibility more stringent, and changing federal reimbursements to states.